Hi, I'm Dr. Scott Morrow, San Mateo County Health Officer.
And I'm Cassius Lockett, Director of Public Health Policy and Planning, San Mateo County. So, what do we need to know about flu in San Mateo County right now?
Get your flu shot, get your flu shot, get your flu shot. It's not too late, do it now. That's the most important thing. We're really seeing lots of flu in the county right now.
Is there any priority groups we should be concerned about?
Well, basically everyone from the ages of 6 months on should be getting their flu shot. But the very young are at particular risk, and the very elderly are at particular risk. But everyone, if they haven't gotten their flu shot yet, get it. There's a variety of places to get it. They get it from the doctor's office, they can get it from pharmacies, but it is not too late, and they really need to do that now.
So we're encouraging everyone greater than 6 months
Yes.
to get their flu shot, regardless of their age.
Yes. What other things can we do besides giving flu shots?
Well, in public health, we're concerned with protecting the entire community. And so there's some things you can do to protect yourself and protect others. One of them is diligent hand washing. You want to wash your hands for at least 30 seconds with soap and warm water. And if that's not available, use an alcohol-based hand sanitizer. You want to
How many times a day should we be washing your hands?
Very often.
All the time.
All the time.
Yeah.
So if after you use your computer keyboard, after you touch doorknobs and surfaces, for example. If you go into large congregate settings, shopping malls, you're going to touch a lot of different things. You want to make sure you come back and, again, wash your hands with water and soap. And if that's not available, again, you use the alcohol-based hand sanitizer. You also, if you are not feeling well, you want to stay home, definitely, or away from school. This is important too, because it's important that you get adequate rest to reduce the duration of illness, since flu can last for several days. You want to cut into that time so you can return to work sooner.
And one of the other things we really want to make sure people do is that they cover their cough, and that they cough into their sleep.
Yes.
Don't cough into your hand, cough into your elbow. That reduces the risk of transmission also. And if you're sick, you probably should, and you have a high fever that lasts, especially a fever over 100 and lasts for a day or so, probably should see your doc.
Yes. And the last thing you probably want to at least make people aware of is we constantly touch our face hundreds of times a day.
Absolutely.
And germs love moisture. So you want to make sure you avoid touching your eyes, your nose, and your mouth.
Yeah.
So how bad is the flu this year?
So we're in the thick of it right now. So we are having lots of flu all over the place. Our emergency rooms are very overcrowded. Our hospital beds are at capacity. We're having numbers of outbreaks. We're seeing lots of people in outpatient clinics. So we are in the thick of it. That's the reason people really need to get vaccinated now to avoid this in the future.
Yeah. And we want to continue to do monitor the situation to keep people safe. So we are monitoring long-term care facilities, is that correct?
Yes.
And what else are we doing in addition to that? Are we testing?
So we are testing. So we're monitoring kind of volumes and EDs, which are very, very high right now, which makes me think we're in the peak and the thick of it right now. We're monitoring ambulance transport wait times. We're monitoring actually lab values and lab results of people who are getting specimens submitted for respiratory illnesses. And we're seeing lots and lots of influenza A and influenza B.
There's lots of concern about how effective the flu vaccine is this year versus last year, for example. I'm hearing anywhere that the flu vaccine is effective as 10%, 30%. Can you explain more about this?
Yeah, people need to ignore that, absolutely. First of all, we have no idea how effective the flu vaccine is, and we won't know that until next year. And so just ignore that. The flu shot is absolutely your best thing you can do, and so don't avoid it regardless of how effective you think it is. It will reduce the severity of illness. It may not prevent you from getting it completely, but it will reduce the severity of illness and reduce hospitalization and reduce death. So, I'm really surprised at how cavalier some people are about, we have an opportunity to really reduce a disease which can kill you, And people are just saying, well, it's not effective, I'm not gonna do it, or I don't have time to do it. And it's just,
Well, some people, you know, they always say that if I get the flu shot, I get sick.
they always
Is
say
that
that.
true?
Every one of my patients tell me that. It's not possible. Flu vaccine is a killed virus. You can get sore, and you can get something like a little bit fever because your body is fighting off the vaccine, which is exactly what you want, but you cannot get the flu from the flu shot.
So in closing, what are the main things that the public needs to know?
Well, right now, at this point in time, in January 2018, is to get vaccinated. Do not delay, get it now, now is the time.